Hi guys, what's up? In this video we'll focus on something called pulmonary hypertension. So what's pulmonary hypertension? Pulmonary hypertension is defined as what? Mean pulmonary artery pressure at least 25 millimeter mercury at rest. So as measured by right heart catheterization, or we can say it's a high blood pressure within the arteries that blood pump from the heart to pulmonary. Well, in pulmonary hypertension, the heart has a hard time getting blood through those arteries in the lungs. So as a result, the heart can be placed on to strain over time, become weak. Well, now let's focus on the classification. Classification of pulmonary hypertension is based on the what degree of functional disturbance, okay, which include four, okay, pulmonary arterial hypertension, pulmonary venous hypertension, pulmonary hypertension associated with what disorder of respiratory system plus minus hypoxia, and pulmonary hypertension caused by chronic thromboembolic diseases. Well, now we have the first one. Let's focus on the first one, which is pulmonary arterial hypertension. We have primary pulmonary arterial and secondary. Primary, which include sporadic and familial, while the secondary to what? To connective tissue disorders, to HIV infection, drug toxins, portal hypertensions, or what we call persistent pulmonary hypertension of the newborn. Well, now let's focus on the second one, which is what? Pulmonary venous hypertension. Here we have four things, okay? Left-sided arterial or ventricular heart disease, left-sided valvular heart disease, pulmonary veno-occlusive disease, and pulmonary capillary hemangiomatosis. Well, now let's jump to the third point of classification, which is what? Respiratory, or what we call pulmonary hypertension associated with what disorder of respiratory system plus minus hypoxia. Like what? Like COPD, chronic obstructive pulmonary disease, and diffuse parenchymal lung disease, alveolar capillary dysplasia, alveolar hypoventilation disorder, and what we call severe kyphoscoliosis also. Well, the fourth point of classification, we have what? Pulmonary hypertension caused by chronic thromboembolic disorder, like what? Like thromboembolic obstruction of the proximal pulmonary artery in situ of thrombosis. And the third one, we have sickle cell disease. Although respiratory failure due to what? Intrinsic pulmonary disease is the most common cause of pulmonary hypertension, well, the pulmonary, or what we call severe pulmonary hypertension, may occur as what? As a primary disorder, or what we call as a complication of connective tissue, as I mentioned it, or as what? As a thromboembolic event. Pathological features include what? Hypertrophy of both media and intima of the blood vessels, and what? Clonal expansion of endothelial cell, and there is marked narrowing of vessel lumen. This with what? With frequent what we call in situ thrombosis or observed in situ thrombosis. This leads to what? An increased pulmonary vascular resistance and pulmonary hypertension. And now let's focus on the clinical feature of pulmonary hypertension. Typical symptoms include what? Breathlessness, syncope, fatigue, chest pain, and palpitation. Well, the important signs include what? Include rise of JVP, okay, parasternal heave in the case of right ventricular hypertrophy, as I mentioned in the examinations video, okay, and the third one, right ventricular third heart sound. And now let's jump to the investigation of patients with pulmonary hypertension. Pulmonary hypertension is suspected if an ECG shows what? Right ventricular strain pattern, or what? Chest X-ray shows what? Enlarged pulmonary artery or right ventricular enlargement. Okay. Well, the third one, we have right heart catheterization to assess what? To assess pulmonary hemodynamics or measure the vasodilator responsiveness. And now let's jump to management of patient. First of all, start with diuretic. Diuretic should be prescribed for those with what? With right heart failure. The second one, we have supplemental oxygen should be given to maintain the what we call partial pressure of oxygen, PaO2, above 60 millimeters of mercury. The third one, we have anticoagulation therapy should be considered unless there is an increase of bleeding. Okay. The fourth one, we have digoxin may be useful for those patients may develop what? arterial tachyarrhythmia. Excessive physical activity that leads to what? Distressing symptoms should be avoided, but otherwise patients should be encouraged to remain active. Okay, and other step, we have pneumococcal and influenza vaccination should be recommended. And the last point in management, we have what? Nitrates should be avoided with what we call beta blocker, poor tolerated, and cyclism can be aggravated pulmonary hypertension should also be avoided. Thanks for watching this video. That's all about pulmonary hypertension.